My name is Dr. Bruna Pellini, and I'm the Chief of Thoracic Medical Oncology at Baptist Health Miami Cancer Institute. When people ask me what drove me into medicine, there are two answers to their question. The first one is what my parents tell me, that when I was 5 years old, I told them I wanted to be a doctor and I was gonna cure cancer, which is quite frankly surprising because there was no one in my family with a cancer diagnosis. And the one that I remember is when I was in middle school, we had a health fair, like career fair really, and one of my classmates' dad was a gynecologist, and then he talked a little bit about what that entailed, and I thought it was fascinating, and then I decided I wanted to be a doctor when I was 12 years old. When I was in high school, I did volunteer work at an infusion center at a university hospital because my aunt is an oncology nurse, and that just solidified my wish to be a doctor and to be a cancer doctor. My expertise is in treating patients with thoracic malignancies. The most common type is lung cancer, but I also treat cancers that are called mesothelioma, that is a cancer that happens in the lining of the lung, and also thymic carcinomas, that are cancers that happen in a gland in the center of the chest. I believe in thoracic oncology, we're gonna learn more about the genomics, the genes that drive cancer, and there will be a lot of developments in new therapies to treat cancer. A major area that I focus on all my research efforts is liquid biopsies, which means detecting cancer DNA in the bloodstream before we can see that in imaging. And I think in the future, we will be adjusting treatment accordingly to that technology so we can make patients live longer before we can see disease on the scan. One of my passions is mentoring trainees. I know the impact of a good mentor in someone's career. So I always work with medical students or residents and fellows and early career oncologists because I always want them to be better than I am, and I want them to have the opportunities that I was granted earlier than I was granted.